The nation is slowly reopening with businesses providing limited services, but wherever we go, we need to remain vigilant when it comes to protecting ourselves and those who are compromised from the coronavirus. Dr. Dolsey of ProMedica Health joins us this morning with who is at risk and what precautions can be taken. Good morning, doctor. Thank you so much for joining us today.
Thank you for having me.
Absolutely. So right now we know people are getting excited. They're like, okay, we can go to the salon soon. We can go to the restaurant. But the governor said yesterday, hold on a second. This is good news, right? We want to open things back up, but we really do need to be careful still.
Yeah, so you want to make sure you're maintaining your social distancing. You want to make sure that you're frequently washing your hands. And I would recommend wearing a mask. So you want to do all those things to help prevent the spread of this virus.
Because we know, and we've been talking about this, there are groups of people who are more susceptible to this. Their symptoms may be more severe, and these are maybe where we're seeing some of the fatalities with the disease. So talk a little bit about those groups of people who are at most risk here.
Sure. So we know that people who have hypertensive heart disease or heart disease in general are at higher risk. People who have underlying lung disease, chronic asthma, COPD, they're also at higher risk. So people who are immunocompromised, who don't have the same immune system as someone else would have due to varying issues, they're at higher risk. So we want to make sure you're staying safe, you're doing all those things you're supposed to do, and you're keeping yourself healthy. Also, older adults, people over 65 are at higher risk.
And you are a cardiologist, right? So these are your patients, as we talk about some of those underlying risks. Are you seeing anything, in the office just yet?
Well, so I also work in the hospital, so we're seeing a lot of patients in the hospital. And COVID-19 also can affect the heart, can cause cardiomyopathy. So I'm seeing some of those patients as well. The other big issue that I would say is racial disparities when it comes to COVID-19. We know that there's a higher risk for African Americans because some of those underlying health issues that are more prevalent or are worrisome are more prevalent in the African American community. Also, living conditions can be different for African Americans, meaning living in more densely populated areas. They may live further from a grocery store. They may live further from a medical facility. So all those things affect higher rates of coronavirus in the African American community and Hispanic community.
And there can be, that underlying stress, as well, that obviously impacts our immune systems and things like that as well, right?
I would tend to agree with you. Also, African Americans and Latinos and Hispanics tend to live in multi-generational households, so households that may contain a grandmother, a mom, a dad, and children. They're also more likely to be our critical workers, our frontline people, our licensed practical nurses, our phlebotomists, our people who are working in other forward-facing jobs.
So that's why it's so important that we all do our part here, right? We feel fine. We feel like we're young, we're fine, but that's why we need to just make sure we could be carrying something, wear those masks, wash our hands, keep the distance. It's so important. And I think we look to the future and we're hoping that maybe a vaccine will come online here. Maybe we talk a little bit about antibody testing. Can that be helpful here, hopefully, in the future?
I think in the future, antibody testing will be helpful. I'm hopeful that if you get the infection, it does confer some immunity to you. So that would be good. The other thing is wearing a mask. I think that's something that we can do right now. And I give the analogy that as you grow up and you teach your kids, you tell them to cover their mouth when they sneeze or when they cough. It's just good manners, good home training, as my grandmother would say. So I would say the extension of that would be to wear a mask. That's good manners. You're not doing it for you, you're doing it for other people.
Right, it's a courtesy. Yeah, extend that courtesy to others around you, and just, I think when I see someone wearing a mask too, I feel better that I said, okay, I think they're trying to help me out. We're trying to help each other out.
And that's exactly right. And finally, once we get that mindset that is not just about me and that we're really all in this together.
Yeah, absolutely we are. And we thank you so much for what you're doing every day on the front lines. Thank you for joining us this morning, and stay healthy and safe out there. Thanks for joining us.
Thank you.
Yep,
I appreciate
it. Yep.
Bye-bye.